Saying the coronavirus pandemic has completely changed our way of life is a vast understatement. It has killed over 100,000 people in the United States alone and has hurt many more in all ways imaginable. As the virus replicates within the lungs of a patient, it causes worsening respiratory symptoms and, in some cases, death. Patients who need intensive care may be put on ventilators for up to 2 weeks, fighting for their lives the entire time. There is currently a dire need for a treatment method that can reduce the viral load within late-stage patients. With this in mind, we designed the Radiologically Enabled Anti-COVID-19 Targeting System, or REACTS for short. REACTS is a treatment method that involves a patient inhaling particles via a nebulizer, which then enter the lungs and attach to the virus. These particles are harmless at first, but once they are hit with a small dose of radiation, they deactivate the coronavirus. With a reduction in viral load, the patient's condition would deteriorate more slowly or even improve, giving their body a better chance to fight back and recover from the virus. With tens of thousands of new cases every day, hospitals in the United States are desperate to have readily available resources. This treatment will not only directly save lives, but will also open up more hospital beds and ventilators, and free up staff so that other patients' lives can also be saved. A manufacturing cost of only $4 per dose will make REACTS accessible to all people who need it. Even though REACTS is considered a Type 9 combination product by the FDA, most of the technology it is dependent on already exists and is commonly used in all hospitals. REACTS is meant to be a low-cost, fast-acting treatment for COVID-19 that can help hospitals free up resources and shorten recovery times. But in order for REACTS to start saving lives, we need your help. We have designed a pilot experiment involving a technique called quantitative polymerase chain reaction, which can be used to show to exactly what degree the virus is being deactivated. Supplementary imaging will also be done to both confirm the quantitative data and to observe if any unexpected phenomena occur. To complete this experiment and future ones, we are asking for a grant of $40,000. The majority of this funding would be used to purchase qPCR test kits, nanoparticle raw materials, and other laboratory essentials. The remaining funds would cover the cost of intellectual property, which can range from $5,000 to $10,000. We are also seeking to work with partners in the future. Some potential partners we are planning on reaching out to include, but are not limited to, the University of Georgia Health Center, Prisma Health, and the Medical University of South Carolina. Join the fight and help us help the world.